to a viewer question from Ron. He's a New Yorker. So he said he's been living apart and his part of the city was hit hard. And he wants to know the following. Now that I received the vaccine, what are the chances of me becoming severely sick or mildly sick from this virus? And what are the chances of me carrying it to others? My very elderly parents also received the vaccine. Is it safe for me and my kids to now visit them at their home? You answered a little bit of that, doctor, but let's take it on for Ron and make him happy.
Yeah, so that's a great question, Ron. And honestly, sometimes I feel like I'm doing mental gymnastics when I'm thinking about all the different kind of combinations of different vaccinated and unvaccinated people and what's okay and what isn't. But Ron's question raises a few really good examples for us to talk through. So we know that the vaccines do an excellent job of preventing serious illness, hospitalizations, and death in people who have received them. So for Ron and for his parents who have received the vaccine, I think it's very reassuring that their risk of getting really ill with coronavirus is significantly decreased, and really at this point kind of as low as that we can lower that risk once you've had the vaccine and once you're 2 weeks after that second dose of vaccine if you had a 2-dose series. And so the current CDC guidelines would support Ron and his unvaccinated children visiting with their grandparents, because all of the higher risk people in that scenario, so the grandparents and potentially Ron himself, depending on his age, have really good protection from getting sick because they've had the vaccine, and the children are considered to be low risk even though they are unvaccinated at this time. So that gathering would be felt to be safe per the current CDC guidelines.
And Ron has another follow-up question that I have here. I want to read it. And I really like this question. He wants to know how long the vaccine will provide immunity. And do you anticipate we will need a booster shot? I've heard that question a lot. Your thoughts, doctor?
Really good one, and something that I think we don't yet have a final answer on, but we have some better understanding than we did a few months ago. So Pfizer has released kind of the 6-month follow-up vaccine data that shows that the vaccine 6 months after the second dose retains really excellent protection, about 90% from illness with COVID-19. So that's really, really good news. That's the furthest out that we have heard so far. But obviously these trials are still ongoing and they're still following the people who received vaccine through the trials. And so as more time passes, we will learn more and more about how long the vaccine protection extends. One of the kind of complicating factors here, though, relates to the variants that everyone's been hearing about. And certainly as we continue to see circulation of the virus and still quite large outbreaks in some parts of the world, there certainly is the possibility that variants may emerge and that the current vaccines may not provide optimal protection against new variants. And so that's why it's really important and why there's been such a push to try and really drive down our infection rates here in the United States quickly. The quicker we decrease transmission and spread and new infections, the less likely it is that newer variants will emerge. And so that's why it's a bit hard to answer that question definitively right now. Firstly, not enough time has quite passed. And secondly, the variants throw a bit of a complication into the question about boosters. But we will be learning more about that as time comes. It's possible there's a few scenarios. For example, every year we have to change the flu vaccine to match kind of circulating strains of the flu. And so is it possible that the COVID vaccine may become something like that, where it needs to be modified and boosted each year based on what variants are circulating? That is a possibility that is being considered, but we're not going to have a definitive answer on that until we kind of see how the next few months play out.
And doctor, we get so many questions here on Dr. Q&A. This is one that comes up a lot, and I'd love your thoughts on this one. If my child had COVID-19, why do they need to get vaccinated?
Yeah, another fantastic question. So we know that when you get an infection, your immune system responds to it, and usually your immune system is able to clear it, take care of it on its own, and generates some sort of memory to that infection so that we don't keep getting sick over and over with the same infections. That's what our immune systems are kind of designed to do. We know kids' immune systems especially do a really good job of that. They're really good at recognizing new infections and helping to fight them off. With COVID-19, we know that for probably about 90 days or 3 months after you've had the infection, you likely have some protection. It's been pretty rare for people people to get reinfected during that period of time, for example. So we do think that there's some immunologic protection that you have during those first 3 months or so. But beyond that, it seems quite variable, and certainly there have been people who have had reinfections, and we don't know kind of exactly how long that protection from the initial infection lasts. And probably it's not just one answer. It may vary based on your age, based on how severe your initial infection was, different factors like that. And so even if you've had COVID-19 infection, the recommendation is that you still get the vaccine when you become eligible, because at least the preliminary data is showing that the vaccine immunity is more durable than probably what you get from the natural infection itself.
Let's talk about a couple of myths. There are so many myths when it comes to COVID-19, but I'm going to tackle on two of them, if you don't mind, with the time permitting, of course. One of them is on the genetic material in the vaccine can get into our DNA, affecting us later in life. I hear that one a lot, doctor, and especially with teenage girls and the fear of fertility issues in the future. So can you take those two myths for me?
Sure. Yeah. So I'll start with the first part. So the two vaccines, the mRNA vaccines, essentially mRNA is like a recipe for a protein. So it's the instructions for a cell to produce a protein. And in this case, the recipe is for the spike protein that we see on the surface of the coronavirus. And so I've heard this one come up a lot. It is biologically impossible for mRNA to incorporate into our human DNA. Where the mRNA goes in our cell is outside of the nucleus, and the nucleus is where our own human DNA is held. And so the mRNA doesn't ever come anywhere near our own genome. The other really interesting thing actually is that this mRNA vaccines, which actually have been studied for a long time, one of the challenges that they had to make an effective vaccine was that the mRNA actually breaks down very quickly in our bodies. And so they actually had to figure out a way to make it last long enough that it was able to produce these proteins to give us protection from this infection. And so the length of time that the mRNA is really in our bodies is very short, and there's no way for it to become incorporated into our own DNA. The second part of the question was related to these questions that have arisen around effects on fertility, and there's really been no data to suggest there's any impacts on fertility. There's been many people who have had COVID-19 infection itself now, who have had vaccine, who have gone on to become pregnant and to have healthy pregnancies afterwards, and we haven't seen any information to suggest that there's any impact on fertility at all.
And I'm glad we talked about that, because even my daughter, who is going to be 20 soon, she said, "Did you hear that if I get the vaccine, I'm going to have issues with fertility in the future?" And I said, "Where did you hear that?" And it's just amazing how the word of mouth, and then the teenagers get concerned and the parents get concerned. And that's why we do shows like this, to clarify.
Exactly. Yeah, it's really important. And I know there's so much information that we have access to, which is great. But in some ways, it becomes even trickier to know what out there is accurate and what to believe. And so I think it's really important that people make an effort to try and get their information from kind of validated sources, because there's a lot out there that, especially when it comes to things like vaccines, that's not entirely accurate.
Let's just remind our viewers, if you have a question for our expert, all you have to do is send your question to questions@allhealthtv.com, or just give us a call. So much easier, 855-796-4475, either or, whichever one you prefer. Okay, so camp. Doctor, so many kids missed out on camp, lots of fun. Parents, do they seem to be concerned? Should they be concerned about sending their children to camp during the pandemic this year?
Yeah, this is another great question that we're fielding a lot in our clinic. I think I would be remiss not to mention kind of the impact that this pandemic has had on kids, not necessarily the virus itself, but on their mental health, on their schooling, on their education, on their socialization and ability to spend time with their peers. And we have seen for sure during the pandemic increasing rates of mental illness, anxiety, depression, all sorts of things that kids have really been suffering from, even though they haven't been the ones winding up in hospital with COVID-19 as much as the older adults and elderly. And obviously, things like summer camp have a huge impact on kids' well-being and mental health, and it's something that many of them missed out on last year. I think there's a few kind of really important things for families to consider when they're making this decision about summer camp, and it certainly will be kind of an individualized family-by-family decision that needs to be made this year. The CDC has released some guidance on things that camps can do to set up as safe of an environment as possible in the setting of pandemic for kids and staff. And so certainly there are things that families and camp staff can do. For example, anyone over 16 years of age who may be working in a camp should be vaccinated before they work in that setting. That really helps to protect themselves, but also all the campers and children that they'll be working with, many of whom may be too young to be approved for a vaccine yet. And then all of the other measures that we've been talking about during this whole time, so masking, especially in indoor settings, physical distancing, excellent hand washing, all of those things need to continue to be done in camp settings for sure. There are certain types of activities that might be higher risk in a camp. For example, eating, usually there's some sort of kind of dining hall setting that campers eat in. And it's a high risk time because you can't wear a mask when you're in that kind of
Sure.
setting when you're eating. And so making sure that those things are all adhered to is really important.